You would think everyone knows how to brush their teeth, because it seems like such an easy task. Unfortunately, many people don't know how to brush their teeth, at least in a way that is beneficial to their dental health. A good number of people will spend up to 10 minutes for brushing their teeth, others will spend only few seconds, while a majority of people will scrub their teeth vigorously. While it is important to keep your teeth clean at all times, you should note that exerting excessive force on them can cause serious problems. The dangers that come from exerting too much pressure during tooth brushing cannot be underestimated. Hard brushing causes the enamel to wear off, which exposes cavities. This leads to extreme sensitivity when exposed to hot or cold temperatures. Another result of brushing too hard is the receding of the gums. This is a rather serious condition that needs immediate attention from a dentist. Receding of the gums can lead to periodontal problems, which is a dangerous disease. Once a person has periodontal disease, they become prone to being victims of diseases like diabetes, stroke, heart attacks, and other heart-related problems. It's something that should be avoided at all costs. It's important to reduce the pressure exerted on your teeth, and spend at least 40 seconds on either side of the mouth, and another 40 seconds on the front portion. This totals to at least 2 minutes. It's important to tilt the brush at a 45-degree angle towards the gums, and brush in a circular motion. These healthy habits should sustain your teeth in a healthy state, until your next visit to the dentist. A number of toothbrushing techniques have achieved acceptance by the dental profession. Each technique has been designed to achieve a definite goal. Depending on the individual cases, the techniques of toothbrushing may have to be altered to achieve the maximum beneficial effects. Here you can see various toothbrushing techniques. The Bass method, the Stillman's method, the rolling stroke method, and the Charters method. In the Bass method, we need to position the filaments up toward the root at a 45 degrees angle to the teeth. Place the brush with the filament tips directed into the gingival sulcus. By using a vibratory stroke, we have to brush back and forth, with very short strokes for the count of 10. After that, we have to reposition the brush to the next group of teeth. In the rolling stroke method, we need to direct the filaments toward the root of the tooth. We need to place side of the brush on the gingiva, and the plastic part of the brush should be even with the tooth. When the plastic portion is even with the tooth, press the filaments against the gingiva and roll the brush over the teeth. The wrist is turned slightly and the filaments follow the contours of the teeth. In the Stillman's method, the filaments are placed at a 45-degree angle to the tooth, just like the Bass method. Unlike the Bass method, the filaments are placed half in the sulcus and half on the gingiva. After that, the same stroke is used as the Bass. In the Charters method, we have to position the filaments toward the chewing surface of the tooth. Place the sides of the filaments against the enamel, and angle them at a 45 degree to the tooth. Vibrate the filaments gently but firmly, and keep the filaments against the tooth. After that, reposition on the next set of teeth. Toothbrushing alone cleans buccal and lingual tooth surfaces. No single toothbrushing technique adequately cleans occlusal pits and fissures. No toothbrushing procedure removes all interproximal and subgingival plaque, especially around malposed teeth and fixed prostheses. Interproximal cleaning aids are necessary to complete the tooth cleaning process.